We have medications called GLP agonists. These are hormones that the body produces itself. And initially, I think in certain animals that there's longer forms of this. So actually, we now can actually make these hormones last for a few seconds to last weeks right now. And these are gastrointestinal hormones that cause us to decrease our gastric mobility, so our bowel don't move quite as fast or slow. They go to the brain, decrease appetite. And we now have the first time in history medications that are game changers for weight reduction. We know that 70% of the people that I treat in my practice are overweight. I'm still trying to change my body composition. My biggest muscle is still my belly button, and I'm trying to make that my smallest. And I'm trying to convert 10 pounds of fat into 10 pounds of muscle, and we'll show you how to do this. So we're now at a transformative stage. So today I saw a patient today who said, Dr. Curnew, Ozempic has been a game changer. It's transformed my life. I lost 50 pounds. I feel so much better. I'm doing the things that I couldn't do before. The conversation from food's gone away. I go to CrossFit. I exercise. I do weight training. I feel great. Then I saw another patient today. He says, Dr. Curnew, you gave me that drug, Ozempic. I feel so sick. How could you do this to me? I'll never try the drug again. So we're going to explore whether or not any of these medications have value for yourself. So Ozempic and Wegovy is the same drug called semaglutide, and we're going to talk about this. So the team has prepared a wonderful presentation, and take it away. Let's hear more. Oh, okay. I guess you're going to hear a little bit about plane gliding. So one of the things is that be curious. This is myself going up on a plane glider. You can see that I'm getting towed behind. There's this plane that's taking off. And now we're in the sky. And when we get to about 2,000 feet, we're released and you're out in the sky and you're flowing with Mother Nature. So that's my goal. I like things that don't have engines. So I like canoeing, biking, windsurfing, kite surfing. And I'm trying to learn how to fly a plane glider. Now, I want to thank all the people at SOSA in Rockton. They put up with me. This is my third season. I'm close to 250 flights, and I'm still not able to fly by myself. Most people are flying solo, less than 100 flights. It's taken me a lot longer, but you know what? I'm enjoying the journey. So when someone says to me, I can't lose weight, I can say I can't fly, but I'm learning to fly. And I will make it in this endeavor. And that's because of perseverance, hard work, and the work of so many people. And so find new ways of being curious, learning new skills. So one of the things is that as you get older, your brain doesn't work as well. I get it. It's hard to, I think gliding has to put about 10 things in your brain. There should be certain things that are second nature. It's starting to come. And so for your weight loss journey or for every health goal, this is the same thing. So if I could have given up at 70 flights and so I can never do this, I'll get there. And if I don't get there, I'm still going to join the journey and I can fly this glider better than before. So please find something that interests you. And I hope you use this for your weight loss journey. If it takes you 250 times to lose weight, so be it. Take 250 times. Next slide, please.
All right, just want to share everybody. We have a new playlist on the channel. Um, as you can see, we have 388 videos, almost 400. So we just wanted to put it together for people. We call it Dr. Curnew Library. Honestly, if you go through these, you'll learn a lot. So we just short into some of the topics. As you can see, some of the most popular topics we have a video on them. We just put the best ones around. The first one, atrial fibrillation and stroke, medications, the statin debate video. You can check them out on your time. Just when you go on the channel, I think in the previous slide we show you can put on the slide button and then you can see everything. So put Greg Curnew, find the channel, click playlist, and you can see this new library.
And you can see
Check
that
that
we have
out.
actually on weight loss. If you just backtrack
Yep,
one more
yep.
time, yeah, we that blue we have a initial webinar on Ozempic back in December 4th, 2021. Maybe you can just put a pointer to that if you can. So we have many things to look at. And I
Yeah.
hope you take advantage of this. And for those who have insomnia, put it on at nighttime to help you fall asleep. Down below, you can see Jerry and his exercise crew that have done a lot of good work on getting people more fit and exercise. There's one on, effective doing a PCI, which is an angioplasty. Everybody says fix my heart, but to be honest with you, having an angioplasty in people who have chronic stable coronary artery disease doesn't prevent a heart attack and stroke. It's only when you're having a plaque rupture that makes a huge difference. If you want to stop smoking right now, on the bottom right is that there's a program called Stop on the Net. You can get free Nicorette replacement therapy at this point in time. People say, what's in my blood? There's a video that just tells you how to analyze your blood work. And also you can actually sign up at LifeLab and DynaCare to get access to your blood work. So please, please, please take the time to be healthy, and take the time to explore your health. I'm exploring a plane glider. You can see up 250 flights I can't fly. There's close to 400 flights here, or different segments you can look at. And the team's done such a wonderful job of putting all this together. So I hope you take advantage of this. Next slide, please.
So now that we have, so thank you, Dr. Curnew, for introducing us and getting us started with this webinar. And so now we're just going to start off with a broad overview of what exactly GLP-1 agonists are. And so this is the classification of medication that Ozempic and Wegovy fall under, which we'll be going over later today. But just starting off with definitions. So GLP-1 agonists, or glucagon-like peptide-1 agonists, they are a class of medication that basically mimic the hormone GLP-1 that is in your body. So in a sense, it's kind of like a supplement just to help your body with the actions that GLP-1 would normally induce in your body. And so what exactly are these actions? They are like your body, the normal GLP-1 peptide, basically it stimulates insulin secretion, inhibits glucagon's release, and also slows gastric emptying. But also these medications are becoming very popular, especially to treat type 2 diabetes and also obesity, especially in patients that have maybe an increased risk of having like cardiovascular events. And so we will be jumping into that shortly.
Okay, so I'm just going to go over GLP-1 agonist effects. So GLP-1 agonists have brain effects such as decreased appetite, and liver, kidney, and systemic effects such as decreased glucose production. And it also controls blood glucose level by stimulating the pancreas and thus insulin secretion, just like David mentioned. And it slows peristalsis and gastric emptying. And it also improves cardiovascular outcomes and ultimately facilitate weight loss.
Doctors would generally prefer to prescribe these drugs, but a few that I've listed here are basically when a patient has been on metformin and have somehow developed the metformin intolerance. That is one situation, which is common, in which patients will be prescribed the GLP-1 agonists, as well if their hemoglobin A1C levels are 1.5% above the target level, or if they have been above target for at least like around 3 months, then the doctor would strongly consider prescribing these medications to mitigate any risks associated with that. And as I mentioned earlier, it's really helpful for people that have a higher risk for cardiovascular risk, or sorry, like a higher risk for major like cardiovascular events. So especially if you have like atherosclerosis or like chronic heart disease, or also like chronic kidney disease, those are some factors that may influence your doctor when prescribing these medications.
And now I'm going to go over Ozempic. So Ozempic is an example of GLP-1 agonist, and it comes in 0.5, 1, or 2 milligrams of injectable prescription. And just like I mentioned, it improves glucose levels for type 2 diabetes patients, and it also helps with weight loss. It reduces the risk of major cardiovascular events, such as heart attacks and strokes. And it is particularly effective with proper weight management, diet, and exercise.
So just to go over a little bit of what the dosing actually looks like for these drugs. So for Ozempic, on the topic of Ozempic, basically they come, as mentioned, in these little like pens that are either 0.25 milligrams, 0.5 milligrams, up to, I believe they said 2 milligrams. And so what your dosage would start off looking like would be a weekly dose of 0.25 milligrams for the first 4 weeks typically, and then it would typically double in like the following 4-week intervals. So say 0.25 milligrams for the first 4 week on the weekly injections, and then followed by 0.5 milligrams weekly for the next 4 weeks. So from weeks like 5 to 8, and then up to a maximum of 2 milligrams per week, depending on the recommendations of your doctor.
So Wegovy is another
Okay, before we
example.
start, so basically the same drug. So basic Ozempic is for diabetes, Wegovy is for weight reduction. It's the same silly drug or great drug. So Ozempic comes in 2 boxes, a greenish blue or a red box. And basically, they're the exact same price, around $250. And basically, one has twice as much as the other drug. So if you go to the grocery store and you see 2 boxes of Tide detergent, a big box and a small box, twice as much for the same price, you're going to buy the big box. So what we're going to try to do is keep the cost down by using the big box. When it comes to Wegovy, there's a lot of boxes out there. And we're going to learn about how many different pens they are, but it's Rudy, what the smallest one, how many milligrams do you get in the small one of Wegovy again?
It starts off with like 0.25 milligrams and then goes all the way up to
No,
2.4.
but how many milligrams is in that? We'll get to that in a sec over here. But basically, you can get over 9 you'll see something really extraordinary. And I got this letter from this pharmacist saying that you shouldn't count clicks. But you know what? You can be throwing away money that you don't need to, either through your insurance plan or personally yourself here. So we're going to actually show you how to get good value for your dollar from these medications, because you can spend, if you want, $500 a month, or maybe if you're really lucky, you can spend $50 a month and get good results depending on what your needs are and what size pen you're using. So we're going to actually spend some time talking about that. And it ceases to amaze me how that can happen, but it's happening. So we're going to take advantage of this. Keep telling us more.
Oh yeah, so just to go over a bit of the dosing of Wegovy. So like Dr. Curnew said, at the end, you will notice that Wegovy, it tends to be able to go up to a higher dosage if you're taking the maximum amount that they generally recommend. But it is very similar, like the dosing schedule to Ozempic, because it is in sort of 4-week intervals where you start off with, like 0.25 milligrams per week for 4 weeks, and then you double it and double it and double it. But it's just that for Wegovy, it will potentially, you can max it out at a higher dose per week at 2.4 milligrams. And we'll go over this a little bit in detail later as well.
Okay, so if you go back again, just go back by that slide there. Very important is that Ozempic comes 0.25, 0.51, and you can go to 2 milligrams. But we're going to tell you in diabetes, from 1 to 2 milligrams, you double the cost with almost no real benefit. Wegovy, after 1 milligram, you go to 1.7 and to 2.4 milligrams. And you have to decide how much you need. Do you want 6 coats of paint on your house, 2 coats of paint? And we'll show you how to make those decisions. And each of those pens, you can see 1, 2, 3, 4, 5 different pens available. And they have different amounts in there, all at the same price. Tell us more. So we're going to spend a little more time about this.
Okay, so I'm just going to break briefly compare Ozempic and Wegovy. So Ozempic is primarily for type 2 diabetes and type 2 diabetes management, and then Wegovy is for chronic weight management in adults with obesity or overweight with at least one weight related conditions. They are both medications should be given as a subcutaneous injection once per week. And in terms of like the benefits of Ozempic, it includes significant reduction in glycated hemoglobin levels and weight loss. And then for Wegovy, the benefits include significant weight loss and improvement in weight-related conditions. For the side effects, both medication can cause gastrointestinal issues such as nausea, vomiting, and diarrhea.
Let's pause here. So basically, Ozempic, Wegovy, the exact same drug called semaglutide. I'll repeat that. Ozempic, Wegovy is the exact same drug called semaglutide. And it's packaged for Ozempic for diabetes and packaged for Wegovy for weight reduction. This allows insurance companies to deal with this. Am I treating weight loss or am I treating diabetes? And basically, you're getting the same drug, and we'll show you how to get good value for this. Now, it's very interesting. In the clinical trials, almost everybody gets to the highest dose. In our practice, almost nobody gets to the highest dose, and everybody complains of side effects. So the first message is that if you're getting stomach problems, you're getting nauseous, getting upset stomach, good, the drug is working. It's you have to now control how you're getting it. So when I took the drug, I took 0.25, I felt sick. 0.5, I threw up. I now am not using the drug, but I can actually tailor that to what I need. And you don't have to use 0.25. You can use a fraction. You can do 1 or 2 clicks. You can look at the pen and get sick, and that would be enough for you. So this business, go slow and adjust the dose. So, is that if you're gonna go down the double black diamond on your ski hill for the first time, you're gonna crash and break every bone in your body. So if you're gonna take too high a dose too quickly, you're gonna get into problems. And some people can take all this drug and nothing happens to them. Most of us are very sensitive. I am very sensitive to the drug. I can just look at the drug and I have problems. And that I'm a cheapskate. I don't have to use very much of it. Some people have to use more of that circumstance. The other thing is, if you're getting sick on the drug, you're eating too much and you're eating the wrong foods, or you're drinking too much alcohol. And so basically you got to eat, fruits and vegetables. You got to eat very little. And if you're eating nothing at all, good, starve yourself for a while. Polar bears do this all winter long. Most of us have too much adipose tissue. So rule number 1, if you're getting side effects, good. Now we adjust the dose. Take a fraction of the dose. You don't abandon that. It's like my gliding career. If I abandoned, plane gliding at 70 flights, I wouldn't be able to fly. I'm at 250 flights and getting closer to flying. I'm going to get there. So I'm going to adjust the dose as need be. And also to your diet. If you eat the wrong food, too much of processed food, too much, you will get sick, throw up, diarrhea, and you'll feel like shit. So this is something so the clinical trials did that very well. They took people that were motivated to make change, and they supported them. Now, I understand the drug's expensive, but we can make it a lot less expensive and make this work for people. So there are very few people, if you really work at it, cannot take the drug. There are people with certain, multiple endocrine neoplasia, certain forms of thyroid cancer, can't take the drug, recurrent pancreatitis. I get it. But for the vast majority of us, we can actually use the drug. And it's one of those medications that prevents heart attacks or strokes, heart failure, improves quality of life, does a lot of good things. So just think about that a little bit. All righty. I'll be quiet for a little bit. Tell us more.
So we know that was a lot of information for you to digest, but we just have this as a table of comparison for the key points that we want you to know today, and also a little bit more. But both medication, as Dr. Curnew has mentioned, they are prescribed to, lower the risk of heart attacks and strokes and other cardiovascular events. But the higher dosage of Wegovy does make it more suitable for weight loss and obesity, whereas it's just mainly for like the diabetes for like the Ozempic. And then both medication is very important to note. They are not interchangeable, and they definitely should not be taken simultaneously. So you either just do one or the other. And they also all have their own side effects. But Wegovy is generally more costly than Ozempic, especially from an uninsured perspective. So that may factor into your consideration. But also the fact that both drugs are listed on the FDA's drug shortage list. So it may be difficult to come by at certain locations, but generally it shouldn't be too big of a concern.
Well, first of all, your Wegovy and Ozempic is the exact same drug. You can interchange them if you want to. You're just getting a different package to the drug. Okay, it's the exact same drug in a different dosing scheme. In fact, Wegovy at the highest strength is the cheapest way of getting semaglutide, and we'll show you that. So it starts off being more expensive, but we can actually make it even less expensive. So we'll tell you some of that. And I remember when this came out, Rudy got her calculator out, and she'll show you how to do that.
That's
And
what
here you
we're
go.
just about to cover right now. So yeah, I was actually just going to say, so when we do the math and counting clicks, which is something we'll also talk about next, and compare the cost of Ozempic and Wegovy, we can actually make Wegovy a lot cheaper. And so the cost itself is actually dependent on two factors. What dose are you taking? And then what size pen do you have? So when we look at Ozempic, it comes in our 2 milligram and 4 milligram pen, and they both cost $250, as Dr. Curnew has mentioned. This means that at a lower dose, you can get more doses at the same price if you have the larger pen. So at the lowest dose, so 0.25 milligrams, a 2 milligram pen provides you with 8 doses, which of course is taken once weekly. So this makes it $125 a month. With a 4 milligram pen at the same lowest dose, the price becomes $67.50 a month. It's important to remember, however, that 0.25 milligrams is the starting dose, and it's likely that you'll have to increase it. And then once you get to a weight that you want, you could start to taper off, which is something that we'll also explore later in this sharing. So at the next dose, which is 0.5 milligrams, a 2 milligram pen will cost $250 a month, and the 4 milligram pen will cost you $125 a month. And then as we go up a dose to 1 milligrams, that 4 milligram pen would then cost you $250 a month. And Ozempic can be prescribed at 2 milligrams, as we've explored, which would then leave you with that 4 milligram pen being used for 2 doses, which would be $500 a month. It's unlikely, though, especially with Dr. Curnew mentioning that patients even do go up to 2 milligrams. So it's likely that your costs will be a lot lower than that. So for Wegovy, as Dr. Curnew mentioned, it comes in 5 pen sizes. And interestingly, they have these reusable pens and then also these once kind of one-use pens. And right now, pharmacies have these multi-use pens more available. And so they have the 5 sizes. And Dr. Curnew prescribes you with the largest pen, which means you get the most bang for your buck. You can get the most amount of medicine in this, and it's a 9.6 milligram pen. And so that roughly costs you $480 for that pen. It's a one-time payment, and then depending on the dose you take, the cost will be different month by month. So each pen, again, $480. That means at 0.25 milligrams, we have 38 doses, so 38 weeks of medication for you. And that puts that at a price point of $50 a month. And then at 0.5 milligrams, so when we double that dose each week, it provides us with 19 doses, which costs $100 a month. When we go up to 1 milligram, that would then cost us $200 a month. And then 1.7 milligrams costs $350 a month. 2 milligrams would be $400 a month, and 2.4 milligrams is $480 a month. Now, when we also, if we go to the next slide,
Actually, you just backtrack. I could talk about Mounjaro at all, or not?
yes. So Mounjaro as well, we don't often prescribe that at Dr. Kearney's office because we do have Ozempic and Wegovy more available, and Mounjaro is actually quite expensive, and insurance coverage can be a lot harder with this medication, but its monthly cost is around $1,000 to $1,200 depending on the pharmacy. And more information and more research is coming out with this medication as well, and it's proven to be quite effective as well in weight management.
So it's actually better than Ozempic for weight reduction because it blocks 2 hormones. And this would be the most expensive way of doing it. Again, by counting clicks and actually drawing up in syringes, you can actually get better value. But we'll explore that at a future date. So right now, the workhorse right now, because Mounjaro is not readily available. The bigger size ampules are not that available right now. But I think this is going to be a wonderful drug for many people, and we'll show you how to make that cheaper in the future. But this is actually very important to look at. You for $50 a month. If you're sensitive and you do all the right things, you can lose a lot of weight and keep the weight off. Or you can say, my insurance is going to pay for everything, and I'm going to spend $500 a month and feel sick to my stomach and not lose any weight, and say, why is this drug not working? Remember, I told you about 2 patients today. One goes to CrossFit, does something every day. I'm eating carrots and hummus right now. I'd rather have chocolate cheesecake, but this is what I'm going to do. And this morning I was playing squash, lifting weights. I'm lifting weights tomorrow morning, and Saturday morning we're gonna do some more squash and lift some weights, and I hope you do that too. So one of the predictors of successful weight reduction long term is 60 to 90 minutes of significant exercise most days of your life. And if you're too busy to do that, I understand, but if you may be too busy to lose weight too as well. But this is, tell us more. I'll be quiet for a little bit.
Okay, so moving on to number of clicks. So this is how we can actually make use of that cheaper alternative that we were mentioning. So depending on the pen that you get, you may have to count the number of clicks you get. So we've put here a table that depicts exactly the dose that you're taking and how many clicks you would need per dose. So at 0.25 milligrams, a 2 milligram pen, you would need to do 19 clicks in order to get that dose of 0.25 milligrams. And it's the same for the 4 milligram pen. At a 0.5 milligram dose, both pens, you would need to click 37 times to get your 1 dose, and then repeat that every week. And that then for 1 milligram, it would be 74 clicks per dose. And that is for the Ozempic pens. Now for Wegovy, again, the 9.6 milligram pen that Dr. Curnew prescribes, and that's the largest pen, you would need 8 clicks to get to 0.25, 15 clicks for 0.5, 31 clicks for 1 milligram, 53 for 1.7, 63 for 2 milligrams, and then 75 for 2.4 milligrams. And this way you're making the most out of the largest pens that you can receive.
What's a click?
So as you turn the pen, you'll hear these little clicks. Yeah, so Dr. Curnew can demonstrate that.
It's like opening a safe. I hear a click, 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 click. And you don't have to be precise. And so we can show you too as well. So we still get some samples of Ozempic right now. So if you're really interested and you're working hard at that, we'll get you started on this if you'd like to. But thanks. Tell us more.
Yeah. So we move on to body composition and lifestyle. So while the focus of this webinar absolutely is on the medication themselves, it's important that we see these weight loss drugs as a vehicle to getting to your health goals, as opposed to the be all end all. You still have to drive the car and shift the gears. And that's what, when we're talking about that, we're talking about those lifestyle and diet changes that you have to also make in order to aid yourself in on this mission to lose weight. So randomized clinical trials have actually shown that once individuals stop taking semaglutide, they do regain the weight back. So the step 1 trial extension did find that 1 year after withdrawal of that once weekly subcutaneous injection, even at the highest dose of 2.4 milligrams, participants gained 2/3 of their prior weight loss, and similar changes were actually seen even in their cardiometabolic variables. So when you stop taking these medications, human physiology does prevail. So we see those hunger hormones like ghrelin increase and your basal metabolic rate slowing down, which really makes it challenging to keep the weight off. And so it really highlights the need to make those habit and lifestyle changes as protective factors for yourself as you taper off the medication, or if you no longer can take the medication, or even just to aid yourself in this journey in weight loss to mitigate the regain as much as possible. And it really does highlight the need for ongoing treatment, as opposed to seeing this as some short-term medication to help you lose your certain amount of weight and then stopping because it won't be effective in terms of sustainable weight loss, which is what we really want to see. So if we go to the next slide, we see obesity is a chronic condition. It's important.
Actually, just backtrack one slide though. So this is actually a randomized control trial. People lost a lot of weight, and then they were randomized to actually stop or keep the drug going. And that the vast majority of people who stopped the drug gain the weight back. Now, I've seen some other series where roughly 1 in 6 people will not gain the weight back. So 1 in 6 will not. Many will regain about 2/3 of their weight back over time. So we have to be smart about it. If you get Wayne Gretzky off your hockey team, chances are you can't win the Stanley Cup. Last time Edmonton won with Wayne Gretzky was part of the Edmonton team, and they're still trying to get back to that point, and they have some fantastic teams, and they're going to do it again in the future. I know they have some superstars, but part of this thing is that this drug actually takes the conversation away from being hungry all the time. It allows you, as you point, to shift the gears and do other things as well. And I'll just say this, you're going to tell us a little bit more about this, is that when you starve yourself, you eat less calories, you're going to lose both fat and muscle. And we're going to try to help you how to lose more fat than muscle. And so we'll have to give you some clues about that as well. But it really, for some people, it's an amazing drug. And if 70% of our population wasn't overweight, we wouldn't need the drug. But for many people, this is a game changer. But we have to be smart about this as well, too. It's a costly drug. We can actually use it smarter, intermittently, withdrawal, put it back on and things of that nature. Or you can just do the traditional way, just take the drug forever and do all the right things. And that's certainly an approach too as well. But many of us don't want to do that. And but if you just stop the drug, you're just asking for disappointment. Tell us more.
Yeah, so what Dr. Curnew is telling you is that we walk with you, especially at this clinic. So we walk with you your financial limitations, possibly your weight loss goals, and we can alter those traditional routes to make it possible for you to take this medication. So if you just go back a slide, you were just saying that obesity is a chronic condition. So you need to recognize it as that as well. Like hypertension, it requires continuous treatment as opposed to those short-term weight loss and then discontinuing treatment. So next slide. Excess fat really puts you at a risk for other impacts on your health or your metabolic health. It causes damage to your organs. It can cause cardiovascular disease, type 2 diabetes, musculoskeletal disorders, and even some cancers. And next slide, you'll see an image and a pathway kind of really highlighting to you what that looks like. So a higher energy intake, meaning more calories and food consumed alongside a lower energy expenditure. So that means lower physical activity or increased time being sedentary. It leads to a positive energy balance. So that means we're consuming more calories than we are actually using in our day-to-day lives. So then we see our fat values increasing, which then interferes with insulin, and it creates inflammation across the board in our body. And that inflammation it interferes with those necessary pathways that we need to survive, and it increases our risk of disease and pathology. So next slide. On that line, it's important to have a holistic understanding of obesity. While it's easy to talk about just calories in and calories out, when we dig deeper, we reveal that there are a lot of contributing factors to obesity, both in creating, maintaining, and worsening this condition. It's important that while we're using these anti-obesity medications, we're addressing these vital root causes in order to support our weight loss and reduce weight gain, either if these medications are no longer accessible or affordable to us, or even as our bodies adjust to the medication and become less sensitive. We can attribute it to a slower metabolism, which can occur with age. It can be due to some endocrine dysfunction, so hormonal imbalances. An example could be hypothyroidism. Our genetics can also play a role. So there are some gene pathways such as leptin resistance that can often cause it to be harder for us to lose weight. In addition to low muscle mass and medications that can alter these pathways and increase our risk of obesity. We can also see an increased food intake as another root cause, which can include sociocultural factors, physical hunger, emotional eating, mental health concerns, and once more medications. And then reduced activity. So once again, sociocultural factors, socioeconomical limitations, or even physical limitations like pain disorders, for instance, can make it really harder for us alongside even other comorbidities. So it's important that we're also addressing these root causes as we are on these anti-obesity medications. So now let's take a look at body composition.
Just stop over here. Go back one more time. I'm so sorry. This is a beautiful slide. And people say I have a thyroid condition. The thyroid condition, they may be 5, maybe 10 pounds. The biggest medical condition we have is loss of muscle mass as we age. So it's not uncommon from a 30-year-old to a 70-year-old to lose 50% of muscle mass. Muscles love energy. And to me, the key to a long life is how much muscles you have left. And I think I grew up in the wrong generation. I grew up in the aerobic generation, aerobic activities, running, jogging, playing tennis. But it's really important is your muscle mass. You will lose half your muscle mass. So the ways not to lose muscle mass is don't get older, eat adequate protein, which is not an issue. But yet the most important thing is resistance training, weights, bands, push-ups, sit-ups. If there's no reason why most people can't lift weights. In fact, if you have chronic pain, lifting weights can help your chronic pain. And so this is a big shift at this point in time. Your biggest muscle should not be your belly or your thighs. So please, please, please take this very seriously. It is harder to do as you get older. I get it, but still, again, I'm on my 250th flight, and I'm still going to go till I get there. I hope if it takes you 300 flights, attempts for weight reduction to get there, you get there. But enjoy the journey. Okay, tell us more.
So we're now jumping into the concept of body composition. So that really tells us what is our body made up of. So it's made up of percent fat, water, bone, muscle, skin, and other lean tissues overall. And we can measure your body composition. Now, the gold standard is the DEXA scan, and that's this massive X-ray machine, and it costs a lot of money, but it's quite accurate. But we also have these other scales called bioelectrical impedance analysis scales, and we have quite a few of them at the clinic. We've tried a bunch, we've compared them. I've done a DEXA scan myself, and I compared it to the results of some of these BIA scales, and we found that the most accurate one we've been using for our patients. And so this scale, it measures your overall health and fitness level in terms of those body fat percentage levels. So if you go to the next slide, scientific evidence shows that a healthy body composition will increase your lifespan by reducing the risk of heart disease, cancer, diabetes, insulin resistance, and other health conditions and cardiovascular events. And so your body composition is what will be changing as you're on these medications as well. So it's important that body composition is used as a measure as opposed to just weight alone, because we can take a look at this example. Two people can weigh the exact same, but have very different wellness and fitness needs because of their body compositions. And it's really dependent on, were you previously very active? Are you continuing to be very active? Do you engage in a lot of weight or resistance training? Do you have a lot of muscle mass? And so we see on the right-hand side in this figure that the person on the left and the right, actually, they weigh the exact same, but the person on the left has a 35% body fat and only 20% muscle, and they're a sedentary person, whereas a bodybuilder to the right has 5% body fat and is 70% muscle. So while this is quite a drastic comparison, and that might not be as relevant to some of us, it's important that we still see that there are these minor tweaks in the sense of we might not be getting the full picture just by looking at your weight alone. And so we at our clinic like to take a look at your body composition, and we have 13 metabolic outcomes with this scale, and we look at all of that and assess, what are we seeing on your visceral fat, your subcutaneous fat, what's your muscle mass in pounds, what about the ratio compared to your fat, how can we work on changing these values, and are you on your road to success as you come in and we check you at the baseline, your 1 month taking the medication, 4 months in, are we seeing the progress that we want to see? So it's an excellent tool. These scales, you can buy them online. The one that we use is the Fit Index scale. You can get it on Amazon for $30, and it's a small price to pay to get a great idea of where you are with your health. And I think over here, we're just looking at a table to the right that shows you the different body fat percentages and what's necessary. So the essential fat we need on our bodies is different for women and men. And so that's why we have this table here to show you. So it's 10 to 13% for women and 2 to 5% for men. And so athletes typically have a body fat percentage of 14 to 20% as women, and 6 to 13 for men. Then when we go up to the fitness level, it's around 21 to 24% for women and 14 to 17% for men. And then we're entering the acceptable range. So this is an acceptable amount of body fat that you're considered to be healthy, and that's 25 to 31% for women, and then 18 to 24% for men. And then when we go up to 32% and over, that's when you're classified as obese. So again, body fat percentage that's too high is a risk factor for those chronic illnesses that we have mentioned. Now let's take a look at Dr. Curnew's body composition. He he's kindly allowed us to look at these values here, and he's been using the Fit Index scale over time to measure his outcomes. And here are the main 9 that we see. So we're seeing his weight, his BMI, his body fat, his visceral fat looks good. It's a great sign, Dr. Curnew. It's within the green range. And I know Dr. Curnew always talks about he's still walking really hard to reduce those fat values and increase that muscle mass. But we can even see he's at 50% skeletal muscle. You're on an incredible track.
So I got a ways to go. You can see I have too much fat, not enough muscle. But you know, I'm down right now to 21%. So after all this work, I'm down another 1%. But I'm gonna keep fighting away. Right now, my weight is at 171 pounds. I still have, and you know, my weight can be 5 pounds morning, afternoon, depending, you know, how dehydrated, what I just did, and things of that nature as well. But I find this very motivating to myself. And I hope you find this motivating to yourself too as well, because my blood sugar is too high, and I need to do something about that. And what I'm going to do is I'm going to try to get 10 pounds of fat off and gain 10 pounds of muscle on. So that's my goal. And I'm going to use this scale to help us. And I'm going to use all the resources of all the clinic, my friends, next door neighbor, to do this. I'm not sure how many times it's going to take, but I'm just going to keep doing it. Enjoy the journey.
Absolutely. So here's yet another way to kind of look at your body composition. It's another table that shows body fat percentage measurement and those different increments. But when we look at those other values, the subcutaneous fat, the healthy range is between 12 to 20% for men and 20 to 30% for women. And visceral fat across the board, it's a value of 1 to 12 units is the healthy range. And then fat-free body weight's really dependent on your bone, muscle, and organs, and then on top of that, your weight. So it's very much relative. We do want to see a skeletal muscle percentage of around 30 to 50%, and again, it's better for it to be higher. So that means that you have more muscle on your body than fat. And then your bone mass, again, is dependent on weight, but somewhere from 5 to 8 pounds is typically what we're looking at. On the next slide, skeletal muscle is a crucial tissue for maintaining blood glucose control and energy balance. So lean mass on your body, so that would be your bone density, but specifically your muscle mass, is positively associated with reduced incidence of insulin resistance and metabolic syndrome, a reduced group of risk factors for cardiovascular disease and type 2 diabetes mellitus. So it really reduces your fasting glucose levels, your triglyceride levels, helps with managing hypertension, and then again, obesity and treating reduced HDL as well. And signaling pathways that promote muscle hypertrophy, so that's muscle growth, they're potential targets for resistance exercise, and they have that added benefit for preventing muscle insulin resistance. So how is your body composition changing on Ozempic? Let's take a look at that. So if we just go to the next slide, I've been following up with Ozempic patients for over a year now. Now I understand the text here is really small, but I just wanted to give you a picture of we've been looking at patients for a very long time, doing some coaching and providing support on their weight loss journeys, which has been an incredible privilege. And so with this data, I took a look at how our patients' body composition is changing. I won't read out every little detail on this poster, but you can pause and take a deeper look and deeper dive into it if you want to read more. So if we do go to the next slide, I'll highlight the results of this study. So we looked at patients who stayed on the lowest dose of Ozempic, so 0.25 milligrams for 4 months. And we found that in that time, on average, they lost around 7 pounds, with the first 6 pounds being in the first month. So we can see that lowering effect of that lowest dose in the first month. You lose a lot in the first month, and in the next 3 months, it kind of tapers off. With individuals, though, who started on the lowest dose for a month and then increased to 0.5 milligrams for the remainder of the time, they lost an average of 18 pounds in 4 months, with 5.5 pounds being lost in the first month. So we see that maintenance of continually losing weight within those 4 months. And reductions in body fat showed a very similar pattern with the staying on the lowest dose versus increasing the dose. We also looked at muscle mass. I found that lean body mass was decreasing as well, and that loss was shown to be increased in higher doses as well. So while some lean body mass is to be lean body mass loss is to be expected with weight loss, especially weight loss that is rapid, it's important to make efforts to mitigate this loss. And interestingly, when I separated the patients into the respective classes of obesity, we found that patients with a higher BMI, so a higher class of obesity, specifically class 3 obesity, actually maintained or even gained a little bit of muscle, a range of 0 to 2 pounds, compared to those of class 1 obesity, which lost anywhere from 0 to 4 pounds of muscle in those 4 months. So it really emphasizes that depending on your obesity class, it can have different effects on you as well. But overall, just this study kind of goes to show that we need to take efforts and measures to reduce the lean body mass loss. And there are ways of making sure that we are losing that body fat. And it shows that it's been effective for our patients here at the clinic.
Well, that's actually very important. So for instance, if I were to go on Ozempic now, I run the risk of losing, because I still have some fat to lose, but I don't have a huge amount. So therefore, I have the risk of losing more muscle mass. And so I don't want to use Ozempic at this point in time. I might use it intermittently when I get stuck along the way, or I'm having a bad time, I gain 5 pounds and I'm going through a challenging time. But if you're really overweight, that's the magic of Ozempic, because you're already doing resistance training. You're carrying a big body and you're training your muscles. And so therefore, if you have a lot of fat to lose, you're going to lose a lot more fat. If you don't have that much fat to lose, you run the risk of losing more muscle. So that's important. So this is not a cosmetic drug to get to that, that last 10 pounds, I look good in whatever clothes or whatever you want. This is a drug for a serious medical condition. Overweight kills. And at least so many medical problems, from heart disease to stroke, diabetes, depression, arthritis, Alzheimer's disease. We can go on and on and on, many cancers. So this is not a drug for the last little bit. It's a drug to really help you change your life for the right person. And thank you for pointing that out, and thank you for showing that information. So the dose you lose more the higher dose, and the more fat you need to lose, the more likely the drug will be successful to you. But if you're not prepared to drive the car or do the work, good luck. But I found for so many people who were stuck, it got them unstuck, made a huge difference. It changed their lives. And if I'm nauseous, good, we'll just adjust the dose. Tell us more.
Absolutely. So what can we do about this, specifically the lean body mass loss? So if we just click a slide again, inactive adults experience a 3 to 8% loss of muscle mass per decade, accompanied by arresting metabolic reduction and fat accumulation. So 10 weeks of resistance training can increase lean weight by 1.4 kilograms, increasing your resting metabolic rate by 7%, and reduce fat weight by 1.8 kilograms. You click again. Yeah, so benefits are improved physical performance, movement control, walking speed, functional independence, cognitive abilities, and self-esteem. It can even assist in prevention and management of type 2 diabetes by decreasing visceral fat, reducing your hemoglobin A1C levels, increasing the density of those glucose transporter receptors and molecules that are found inside your muscles, specifically improving insulin sensitivity. And it may even enhance your cardiovascular health by reducing your blood pressure, decreasing your LDL cholesterol and triglycerides, and increasing high-density lipoprotein cholesterol. And even beyond this, we can see functional changes. Dr. Curnew recently highlighted to me that on the fragility scale, even as we think about when we age, you're at higher risk of fractures in your hips and damaging those things. And as we age, that comes with that. But if we're doing that resistance training and strengthening our muscles, we're lowering our chances of damaging our bodies even more, even in situations that we might not have control in. And we're creating these preventive factors, protective factors for ourselves. And if we go to the next slide, yeah.
So it's interesting. A young person's fracture is you fall and you break your wrist. You put your wrist out, you stop the fall. And my wife will never let me forget this. We went bike riding, we had a little collision, and she fell, broke her wrist. I made her drive the car home. I didn't think it was broken. But an old person's fracture is your hip. You fall, you can't catch yourself, you break your hip. And if you fall, break your hip over the age of 65 years of age, you have between a 10 to about a 30% 1 to 2 year mortality. Up to 50% of people will pass away in the next few years after a hip fracture. and only a small percentage gets back to their normal self afterwards. So to me, is that building muscle is important. So please tell us more about this. So build muscle.
Yeah, absolutely. So if we just go back a slide, yeah. So muscle plays an important role in your whole body protein metabolism and in the prevention of certain conditions and chronic diseases. It even helps boost the immune system, in part because of that muscle mass. And so a study actually found that exercise has an anti-inflammatory effect, and habitual exercise improves immune regulation, delaying the onset of age-related dysfunction. So here we're really highlighting that muscle mass and increasing that muscle mass has an overall great impact on your body on so many different fronts and really helps support all of your organ systems. So how can we increase our muscle mass? Let's take a look. So if we move to the next slide and the slide after that, we can see that resistance training has been shown to induce great benefits in all populations, including those at retirement age. So this study to the right found that at the 4-year assessment, after completing either a year of heavy resistance training, moderate training, or no training at all, that 1 year of heavy resistance training could induce long-lasting beneficial effects by preserving your muscle function up to 4 years later. So examples of exercises you can do are included to the image on the left. It's really recommended to focus on compound movements. So those are movements that engage the bigger and muscle groups of your body and engage multiple muscle groups. So that could include your chest, your legs, which include your quadriceps, your hamstrings, your glutes, and even your back, which include your latissimus dorsi and your trapezius muscles. So movements like push-ups and chest press, so that's shown just at the top of the image. That really works your chest muscles. Things like squats and lunges can work the quads and your hamstrings and glutes as well. And different rowing patterns, whether that be a low row kind of at the mid-range level, or even like a lat pull down. If you do have a gym membership, those are some great machines you can use. They engage those back muscles as well. And we'll see on the next slide, Dr. Curnew working really hard. He does a lot of resistance training and he really does practice what he preaches. My personal favorite photo is the one on the right. I think that ab circuit got him real good. But yeah, so we do highly recommend this, and Dr. Curnew has found it to be incredibly beneficial in even improving his body composition, which we mentioned earlier on.
Come join us on Mondays and Wednesdays between 6 and 7 at Dundas Physio on Hyatt Street there. They beat the hell out of you. And the best money I spent. And then I think Darren, he's my squash buddy. In between squash games, we do all sorts of different things. And but I still have a long ways to go. My body composition is too much fat, not enough muscle. I will keep working at it. I'm getting better. I just wish I started earlier. So the earlier you start, the better off you are. It's never too late. There's good data in people who are 80 years of age who do this. They build more muscle. Now, yes, it's hard, but it's also fun, and it's a good group of us. Tell us more.
Yeah, so it's important to also train and adjust your training based on your needs as well. For instance, if you're someone who's experiencing chronic pain or have certain conditions that make it challenging to do weights, swimming or yoga might even be a good place to start. So there's lots of ways you can incorporate movement in your day. But doing resistance training 2 to 3 times a week, even for 20 minutes, can provide great benefits. We can use our own body weight, resistance bands, machines, and free weights. One hack I like to use, and I used a lot during the pandemic actually, when I was at home and didn't even have access to a gym, was that I filled my backpack with heavy books and even like some canned foods, and I'd use that as free weights, and I'd do squats and lunges, even outdoors and enjoying the good weather. So there are lots of ways to incorporate resistance training in your life, even if you might not be able to afford a gym membership. And we can work with you and you can talk to us at the clinic, and we're more than happy to help you set goals and reach those goals as well. But really moderate intensity is what we want to aim for here, which is highlighted in green. It is important to think about the contraindications though to resistance training. So absolute ones are unstable coronary heart disease, decompensated heart failure, and a lot more that you can see on this list here. But in general, for the general healthy person, and Dr. Curnew would talk to you about resistance training if that is a good option for you as well. It's a great thing for everybody to do in some way, shape, or form. And so while GLP-1 medications are effective, diet also does play a crucial role in supporting their efficacy. So a balanced diet prevents nutrient deficiencies, it aids in weight management. So it's really your diet itself is what helps you lose the weight, whereas exercise helps you keep the weight off. And that's something that's very important to remember. So diet is really the most crucial part of this whole equation. And that's why GLP-1 agonists are so effective, because it takes that hunger out of the equation. So incorporating whole foods such as fruits, vegetables, and whole grains into your diet can significantly benefit your health. So you want to limit those processed foods and sugary drinks, and to maintain a stable blood sugar level, and then really prioritize that protein. That's going to be really important to prevent that lean body mass loss that we do see with those GLP-1 agonists. So keeping your protein high and prioritizing that. So things like chicken, turkey, fish, beans, and legumes provide those essential amino acids that build our muscles without having those excess calories. Healthy fats, including those from avocados, nuts, seeds, and olive oil, support heart health and promote feeling full. Fiber-rich foods as well. We have oats, barley, lentils, and even berries are vital for digestive health. And it's very important here that we're practicing portion control by using smaller plates and engaging in mindful eating so that we're preventing that overeating. Meal timing is also a crucial role in blood sugar management, but also in helping with that weight loss. So eating at regular intervals and really prioritizing smaller meals a little bit more regularly, as opposed to those large meals, to prevent feeling nauseous. And I've had a couple of patients report having flu-like symptoms when they've overindulged in food on Ozempic. So it's important to keep that in mind. Diet changes in general might even look like swapping out a certain snack you find yourself reaching out to that might be adding to your daily calories. My personal favorite is swapping crisps and chips for air-popped popcorn. It's important that when you do set goals for yourself, that they're realistic and they feel doable. You don't have to give up the joy that comes with food while on this journey, and we can find ways that make it feel exciting and reasonable for you. Another thing that we wanted to talk about was intermittent fasting. So intermittent fasting is a great thing to incorporate while using a GLP-1 agonist, but even in general, its principle really consists of taking periodic eating breaks. And so you have just a window of time where you're eating and the rest of the time you're fasting. And it really helps boost that metabolism and also prevent you from eating in hours that you might be overeating in. So the American Heart Association states that intermittent fasting can produce weight loss, lower the risk of cardiometabolic diseases, and reduce insulin resistance. And it's been shown to be effective in helping with management of prediabetes and diabetes itself. And early evidence shows that it can be incorporated in management plans. And there's more research that needs to be done to consolidate and solidify this as well. And now if we move on to lifestyle and medication, just in general, just to recap, we've explored in detail lifestyle changes are really important. You know, regular exercise improves your insulin sensitivity and helps with weight management. Adequate sleep is also something that's really important. It regulates those hunger hormones, improves insulin sensitivity. And we also want to stop smoking and limit our alcohol. That reduces our cardiovascular risks and improves overall health. And really evidence shows that the combination of exercise and GLP-1 based therapy can have a synergistic effect on that treatment of type 2 diabetes. So a study actually found that with 60 minutes of resistance training 3 times a week, while no changes in the GLP-1 levels were observed, exercise potentiated, so increased the effect of that GLP-1 receptor agonist treatment. So it really helped increase those effects.
Right, moving on to the research side of semaglutide. So the STEP trial was a phase 3 study that randomly assigned participants to either semaglutide or the placebo, and with neither the participants or the researchers knowing who received which. And it kind of aimed to evaluate the effectiveness and reliability of semaglutide as a treatment for weight loss. So the findings from the studies have shown that there was a remarkable change in weight loss. So participants who were administered semaglutide experienced an average weight loss of 5.2%, in contrast to the placebo group, who only saw a 2.6% reduction in weight. And it's important to note that the study did incorporate behavioral interventions like daily exercise. So the weight reduction wasn't only achieved through semaglutide alone. Additionally, the study also observed improvements in weight circumference and cardiometabolic risk factors along with semaglutide. So that finding kind of underscores the broader health benefits of semaglutide just beyond weight loss. Moving on. So the SUSTAIN trials, again, a phase 3 study, randomized and this time controlled. And specifically, these trials focused on observing the changes in glycated hemoglobin, also known as HbA1c. So HbA1c is important because it's commonly used as a biomarker to measure the long-term blood glucose control in patients with diabetes. So some of the key findings from the study was that there was a reduction in HbA1c ranging from 1.2 to 1.8% with the semaglutide group compared to other treatments. And then participants from the semaglutide group also experienced an average weight loss of 3.5 to 6.5 kilograms. So this kind of indicates the dual benefits of semaglutide in both glycemic control and then also weight loss, weight management. Something else that was observed was that there were fewer non-fatal strokes that were reported among the semaglutide group. Moving on. So with the SELECT trials, it was double-blind, randomized, and placebo-controlled. It aimed to provide evidence of semaglutide's benefits for weight loss, glycemic control, and then also cardiovascular improvements. So it was observed that there was better glycemic control for participants who were using semaglutide, but also there was a 20% reduction in cardiovascular events with the semaglutide group compared to the placebo group. And yeah, so it kind of provides more evidence for the dual benefits of semaglutide in managing blood glucose levels and then also promoting weight loss. Next slide. So just a general overview of the cardiovascular outcomes. So like we saw, there was improvement in weight loss, blood pressure, and then also lipid profiles, which is important in relation to preventing heart failure outcomes. So semaglutide was specifically shown to reduce the risk of developing adverse cardiovascular events, such as heart attacks and strokes, and specifically preventing high levels of LDL cholesterol and triglycerides, leading to a decreased risk of developing heart stroke and heart attacks. And this is particularly important for individuals who have type 2 diabetes, as they are at an increased risk of developing these cardiovascular complications.
So actually, just backtrack one slide again. So it's kind of interesting is that this drug actually, semaglutide, works better for weight reduction without diabetes. I'll repeat myself. If you have diabetes, you don't have as good a weight reduction compared to non-diabetics. And if you just back one more slide to the SELECT trial, this was a trial of about 17,000 patients who had congestive heart failure who did not have diabetes. And it showed a weight reduction and improved their quality of life and decreased cardiovascular events by 20%. Now, it's, in the scheme of things, 20%, not bad. But more importantly, the quality of life went up. Advance your slide right now. You can see that in people, that it decreases your blood pressure, lipid profile. It's a little bit, if you want to lower your lipids, use a lipid drug. Lower blood pressure, use a blood pressure drug. Lower blood sugar, it's a great blood sugar lowering drug. There's a trial called the FLOW trial that just came out as well that showed that the drug decreases proteinuria, damage to your kidneys, and end-stage renal disease. So this drug actually has anti-inflammatory, it has weight loss lowering effects, it has blood sugar lowering effects, it has kidney protective effects too as well. So it has multiple benefits, and we can argue which is the most important. The one that's most important to me, and I think to you, is how much weight do I lose? And I think that's actually a key factor. And some people argue that the effects are independent of its weight. I think we need to explore that a little bit more. But I use this drug to actually, in people that are at risk for heart disease, stroke, atrial fibrillation, cancers, that this drug can make a huge difference. And it's a pleasure to see this drug being transformative in many people. The downside, it's a very costly drug. In diabetes, for instance, you can go up to 2 milligrams. But to be honest, between 1 and 2 milligrams, there isn't that much more benefit in diabetes management or weight reduction. We're talking about a couple pounds. Now, for weight reduction, what is the best dose? We can argue about that effect. And I think the sweet spot is, 0.5 milligrams for many people. But it's quite individual variation to that. So I love this drug. But I love the fact that this drug allows you to do the things that are important to yourself, the diet, the exercise. As Ruhi points out, is that you really need to diet to lose weight and need to exercise to maintain the weight. And more importantly, you need to exercise to actually build muscle. Tell us more. Oh, yeah, go ahead. Go back to the next slide. Go back to that slide there, right here. Sorry. Are we talking about who's talking about this part?
Yeah, that would be me.
Fire
Should I
away.
go? Oh, okay. Yeah. So now we'll be talking about the GLP-1 agonist that's available in the market. So as we talked about Ozempic and Wegovy, they're both semaglutide. And then we have Rybelsus, which is an oral version of semaglutide used for type 2 diabetes, which is taken by mouth once daily. There's Mounjaro, which is a trizeptide, which is closely related to GLP-1 agonist drugs. It's a new part. It's a brand, like a new brand class called GLP-1 and GIP agonist. And there's Zepbound, which is the FDA-approved version of the tirzepatide for chronic weight management. It also belongs to GLP-1 and GIP agonist. There's Trulicity, which is a dulaglutide. It's once a weekly injection for type 2 diabetes in adults and children ages 10 and older. However, Trulicity isn't approved for weight loss. Next slide.
Well, just go back one just for a sec over here. Now, Mounjaro or I can't even pronounce the other name for it is has dual actions. It blocks two hormones, so you actually have better weight reduction compared to semaglutide. There's actually a new drug that actually blocks three hormones, adding glucagon to that equation, and that even has a better weight reduction. So we're starting to uncover ways to help in weight reduction. Rybelsus sounds like a very attractive drug in the sense it's semaglutide, but it's an oral preparation, and very little of the drug gets absorbed. So you have to take it with a sip of water and an empty stomach, and you want to fast for a few hours afterwards, ideally. The problem is it's hard to make the less expensive. It's about $250 depending on the dose that you use. I don't think it's quite as good as semaglutide. That's my personal experience. But excuse me, little hummus is going to stuck to the back of my throat with some carrot there. But so we have lots of options available to us, and I look forward to hearing more about this. Tell us some more.
Yeah, so we'll be focusing on Ozempic, Wegovy, and Mounjaro for the next few slides. Now we'll be comparing the efficacy, first focusing on Ozempic. The study you see right here, the image is called Sustain Forte, which compared the effects of semaglutide 2 milligrams versus 1 milligram on hemoglobin A1C and body weight changes over 40 weeks in individuals with type 2 diabetes. So the mean baseline BMI was 34.6, and the mean body weight of the participant was 99.3 kilograms. So as you can see from the red box, participants receiving semaglutide 2 milligrams lost mean body weight of 6.9 kilograms, while those receiving semaglutide 1 milligrams lost a mean body weight of 5.6 kilograms over the 40-week period. So it shows that the semaglutide 2 milligram was better compared to 1 milligram in reducing body weight, with clinically meaningful difference observed between the two doses.
So that's 3 pounds. I don't know if that's a big difference.
That's what the study said. They said
I know, but this is
yeah.
diabetic. So I'm just saying is that from $250 to $500 a month. That's for the rest of your life. That's a lot of money.
Yeah, compared to the next two drugs I'll be introducing, it's I wouldn't say it's meaningful. So next slide, please. So now we will be focusing on Wegovy, as mentioned earlier in the STEP trial slide. The study assessed the effects of Wegovy, which is semaglutide 2.4 milligrams they use in the study, over 2 years, 2 years in adults with obesity or those who are overweight. The mean baseline BMI was 38.5 with a mean body weight of 106 kilograms. So those individuals receiving semaglutide 2.4 milligrams resulted in 15.2% mean weight reduction, while those who received placebo resulted in 2.6% mean weight reduction. Again, the study showed positive outcomes in terms of weight loss while using Wegovy. Next slide. So this one is Monjaro. The study is called SURPASS-2, which compared the effects of tirzepatide 5 milligrams, 10, 15, and semaglutide 1 milligram over 40 weeks in individuals with type 2 diabetes. For this study, the mean baseline body weight of participants was 93.8 kilograms. And as you can see, individuals receiving tirzepatide 5 milligrams resulted in 8.5% of weight reduction. 10 milligrams resulted in 11% of weight reduction. 15 resulted in 31.1% of weight reduction, which is 12.4 kilograms. And it also shows a comparison to semaglutide, which is Ozempic they use in this case. 1 milligram resulted in 6.2% of weight reduction, which is just 6.2 kilograms. Next slide.
Okay, so now to answer the question, how long should I be on Ozempic for? So if you go to the next slide, and this is something you hear Dr. Curnew say, ideally lifelong. So, and that's because this may look like adjusting doses. So at a certain point to maintain that weight loss. So while actively trying to lose weight, you might be using a higher dose and then slowly taper down to a lower dose that allows you to maintain it. But to get the most benefit out of semaglutide, scientific research suggests that you need to be taking it for at least a year. So it isn't one of those short-term medications, a quick fix for you. But as you adjust those doses over time, it becomes cheaper. But again, just to highlight, obesity is a chronic condition, so it is a long-term use medication. However, in certain situations, whether that be financial or it might be challenging to continue using this medication, if you go to the next slide, there's been some recent evidence to show that there are ways to prevent that weight regain that we saw in that step 1 extension trial that showed that 2/3 of people's weight came back by the end of the year after stopping the use of semaglutide. So they found that a slow taper or weaning off the medication helped maintain weight loss for 6 months after stopping this medication. And they even found that personalized dosing in patients who followed a digital weight loss program can lead to the maintenance of that target weight for up to 6 months later. So there is that kind of protocol that can help us prevent that weight regain at least for 6 months. And then it also goes to highlight that we need to have those lifestyle changes in place to prevent weight regain as well.
So we're going to be comparing the muscle loss between Ozempic and the similar drugs. So in 2021, there was a study published by Ida and their colleagues, which showed that semaglutide leads to a significant decrease in fat-free mass, FFM, which is basically essentially a muscle mass. However, a new study published 2024 by Conte et al. Suggests that the study data don't support the concern that GLP-1 agonist medications cause physical frailty or muscle loss due to weight loss. So if you look at the next slide, we'll see a figure. And this figure shows the effect of marked weight loss induced by GLP-1 based anti-obesity medications. So here, yellow is FM, which is fat mass, and the gray is FFM, which is fat-free mass. So fat-free mass consists of lean mass and skeletal muscle mass. And the results from each medication trials show that 25 to 40% of the weight loss was composed of fat-free mass and lean body mass. So this result led to concerns arising regarding the GLP-1 agonist medications by many different researchers. However, this paper argues that even though weight loss leads to a decline in skeletal muscle mass, SMM, individuals with obesity generally have higher baseline levels of fat-free mass and skeletal muscle mass compared to leaner individuals. Therefore, the decrease in skeletal muscle mass represents only a small fraction of their total body skeletal muscle mass, and it's unlikely to impair individuals' physical function. So if we look at next slide, we'll be comparing the insurance coverages in Canada for these medications. For Ozempic, as of January 31st, 2024, Ozempic's listing status was changed to a limited use benefit in the Ontario Drug Benefit Formulary. So individuals have to fit into this new criteria to receive coverage under the ODB program. For Wegovy, as it is classified as a weight loss drug, it won't be covered by OHIP or any provincial insurance. It could be covered by private insurance plans. However, only a few private plans in Canada cover obesity and weight loss medications. Same goes for Mounjaro. It's not covered by OHIP. It doesn't show up in the ODB coverage list. Some private insurance may cover prescriptions. However, it's unlikely as there is not as much of product available in Canada. So that is what we have.
So if you just go, let's just talk, if you back one slide. So for Ozempic right now, it is covered for diabetes, not as first-line therapy. We have many drugs for diabetes, but the government has said in Ontario, if you cannot control your hemoglobin A1C after metformin. So let's say you have diabetes, your hemoglobin A1C, let's say, is 6.8%. You go on metformin, it goes down to 6.4%, 6.5%, 6.6%. The government is not prepared to pay for Ozempic because your hemoglobin A1C at 6.5% or so is a very reasonable number. So you cannot get it from the government. And what happened is that this rule has been around for a long time, but people have broken the rule. The government's angry. And so to me is that those are the rules. And for weight loss, many insurance companies will argue if you go on the drug, you don't lose 5 or 10% or some meaningful weight reduction, they won't cover it. We can argue whether that's good or bad, but if you're using a drug to lose weight and you're not losing weight, why should your insurance coverage pay for it? You all have personal choices, and you can do what you want, and we can give you good guidance to this. But I found these drugs to be game changers. And they do prevent heart attacks. They do prevent strokes. They do prevent kidney damage. And they improve quality of life. They help arthritis. And they make you feel better. But you have to work at it. And I think for many people, and I found that many people get stuck along the way. One of the reasons that people get stuck along the way, they can't afford the drug. And I understand that. And so there's ways of making it cheaper, as we talked about it, either using it continuously, where we're supposed to prescribe it, or intermittently. And if you go off the drug, you will probably gain weight, but okay, you have to deal with it. And there's so many strategies you can use that, and using it intermittently, using lower doses, counting clicks. It's a huge difference. You can reduce the dose of this drug, the cost of the drug dramatically, but you also need to have your entourage. We have a great entourage here in our clinic with all these young McMaster students that are full of enthusiasm and help me become a better person, and they'll make you a better person too as well. Next slide. So I want to just thank the entire group. This is fantastic. This is a game changer, and it allows us to tackle some issues that are being too hard to talk about. Don't be afraid to discuss costs. Don't be afraid to discuss side effects, but be honest. Is that I'm always gung-ho when I try new things, and some people this could be a Hail Mary, a last-ditch effort, and it may be, and it's been, for some people, it's got them started, it's changed their lives. For other people, I've caused misery. So hopefully I'll cause less misery, more benefit to most people. I think that you guys did a fantastic job. I want to give a special thanks to Amber, who's actually put out those newsletters on a regular basis, and then Ruhi, who's just blossomed and become an expert in weight reduction in less than a year or so. Rad, you've always kept us on going, and everybody else, all these presentations, did a fantastic job. So thank you all for all your hard work. And to me, this is a game changer. And but also, I never thought at the age of 65 that I would be lifting weights. And my story about weight reduction or lifting weights happened about 2 Christmases ago. There's dementia in my family. There's falls in my family. And my brother came to visit at Christmas and he fell down the stairs and broke a few bones. And he's working hard on treating his diabetes and his weight loss. But this caused me to say, I'm going to go into a balance training program that led to a weight training program. And I'm so glad I did it. I just wish I started 20 years earlier. And I hope you start tomorrow. And thank you. Final thoughts. Rad, what do you think?
I just have one thought. I was thinking as everybody was chatting, we had antibiotics that came about a century ago. And now we had statins that made a difference. And now we have GLP-1 medications. Now, I don't want to put them on the same pedestal, but seems like they're going there. And we'll see what the research shows. Every time I open Twitter and look what the publications are, I see something new on GLP-1. So we'll see what that does. But what's certain is that it's a tool in the toolbox. It's not the only tool as we showed today, but it's definitely one of the tools and a game changer tool. So some of the things you have to do beside that is resistance training, the lifestyle. They go hand in hand. It's not easy, but like Dr. Curnew showed, do as much as you can, a little bit every day. And I think that's the most important thing.
And actually, we're going to have a presentation next week. We're going to show you this randomized controlled trial that showed tremendous reduction in LDL cholesterol, loss of weight, gain of muscles, without drugs. And so, for some people, that's terrific. These were a bunch of 30-year-old women who did it. And we'll show you how they did it and how that may incorporate it into your lives. I'm proud of our weight loss team, our mindfulness group. And I'm just proud of all the patients that are working at this. And I hope everybody takes a chance to take a look at this and to do some time. Any final thoughts from anybody? So as the Nike commercial says, just do it. And the best time to start is today. If you wait for the perfect time, the perfect opportunity, it will pass. I may never fly a glider on my own, but you know that I'm going down fighting on all cylinders. I think I will. There were many times where I thought I couldn't do it. And it's through the coaching and the support of so many people that I'm able to do this. So I hope you take the time to think about how to get a better version of yourself. Be mad at yourself for not trying. Just enjoy the journey. And we're going to end right now. Thank you so much, everybody. You guys did a fantastic job.